What is the significance of a rising negative pressure, suction, in the pre-pump venous monitor? A. The oxygenator is clotting. B. The patient has developed systemic hypertension. C. There is an obstruction or suck down at the drainage cannula site. D. The sweep gas flow is too high. Answer: C. There is an obstruction or suck down at the drainage cannula site. Explanation: the pre-pump pressure represents the pull from the patient. If this becomes excessively negative, it indicates that the pump is trying to pull blood that isn't there, usually due to hypovolemia, cannula malposition, or kinking of the venous line. Which of the following is a primary goal of rest lung settings while a patient is on VV-ECMO? A. To maintain a high tidal volume to clear CO2. B. To prevent ventilator-induced lung injury, VILI. C. To keep the FiO2 at 100% on the ventilator. D. To maximize plateau pressures. Answer: B. To prevent ventilator-induced lung injury, VILI. Explanation: ECMO allows the lungs to rest. Settings are typically dialed back, low tidal volumes, low respiratory rate, and FiO2 less than 50%, to avoid barotrauma and oxygen toxicity while the ECMO circuit handles gas exchange. During VA-ECMO, left ventricular, LV, distension is a critical concern. Which echo finding supports this? A. Forceful opening of the aortic valve. B. Smoke, spontaneous echo contrast, in the LV or a closed aortic valve. C. A small, hyperdynamic left ventricle. D. High velocity flow through the mitral valve. Answer: B. Smoke, spontaneous echo contrast, in the LV or a closed aortic valve. Explanation: if VA-ECMO afterload is too high and the LV cannot overcome it, the aortic valve remains closed. Blood stagnates in the LV, creating smoke, pre-clotting, and increasing the risk of pulmonary edema. Which lab value is most specifically used to monitor for ECMO-induced hemolysis? A. Serum creatinine. B. Plasma-free hemoglobin, PFHB. C. Ionized calcium. D. White blood cell count. Answer: B. Plasma-free hemoglobin, PFHB. Explanation: mechanical shear stress from the pump or cannulae can rupture RBCs. Plasma-free hemoglobin is the gold standard for detecting this. A significant rise suggests pump thrombus or cannula issues. When weaning a patient from VV-ECMO, which of the following is the standard challenge? A. Turning off the blood pump. B. Decreasing the RPM to 0. C. Capping the sweep gas, turning sweep flow to 0, while maintaining blood flow. D. Removing the arterial cannula first. Answer: C. Capping the sweep gas, turning sweep flow to 0, while maintaining blood flow. Explanation: to test if the native lungs can handle the work, the sweep gas exchange is turned off. The blood continues to circulate through the circuit to prevent clotting, but the circuit provides no oxygenation/ventilation. In the event of a total power failure and battery depletion, what is the immediate priority for the ECMO specialist? A. Clamp both lines and start CPR. B. Use the emergency hand crank to maintain blood flow. C. Increase the ventilator settings. D. Administer a bolus of heparin. Answer: B. Use the emergency hand crank to maintain blood flow. Explanation: all modern ECMO consoles come with a manual hand crank. In a power failure, manual cranking is required to prevent circuit thrombosis and maintain systemic perfusion, in VA, or oxygenation, in VV. What is the most common site for circuit thrombus to first appear? A. Inside the drainage cannula. B. At the connectors and pigtails. C. In the center of the centrifugal pump head. D. In the sweep gas exhaust port. Answer: B. At the connectors and pigtails. Explanation: thrombus tends to form in areas of stagnant or turbulent flow. Cannula connectors, stopcocks, and monitoring pigtails are prime locations for early clot visualization. A patient on VA-ECMO develops sudden leg ischemia distal to the femoral arterial cannula. What is the best management strategy? A. Increase the heparin dose. B. Decrease the pump flow. C. Placement of a distal perfusion limb, distal reperfusion cannula. D. Immediate explantation of the ECMO. Answer: C. Placement of a distal perfusion limb, distal reperfusion cannula. Explanation: large arterial cannulae can occlude the femoral artery, blocking flow to the rest of the leg. A small distal perfusion line is inserted to divert blood from the arterial circuit down into the lower leg. If the delta P across the oxygenator increases significantly, but the flow remains constant, this suggests A. The patient is bleeding. B. The pump head is decoupling. C. Increased resistance within the oxygenator, clotting. D. The venous cannula has moved. Answer: C. Increased resistance within the oxygenator, clotting. Explanation: delta P is the difference between the pressure entering and exiting the oxygenator. An increase indicates that the filter, oxygenator, is becoming clogged, requiring more pressure to push blood through. Which of the following medications is known to be sequestered, absorbed, by the ECMO circuit's plastic tubing and oxygenator? A. Gentamicin. B. Fentanyl. C. Heparin. D. Potassium chloride. Answer: B. Fentanyl. Explanation: highly lipophilic drugs, like fentanyl and midazolam, are notorious for being absorbed by the ECMO circuit, often requiring significantly higher doses to achieve sedation compared to non-ECMO patients.